we had some really good abstract presentations on developments in AML this morning. We had an interesting update on data from the AGILE study, which is an international Phase III study comparing treatment with Azacitidine with or without the addition of the IDH1 inhibitor Ivosidenib in patients with IDH1 mutated disease. These are data we've seen at a couple of international conferences before, but they continue to develop. And I think they highlight that adding an IDH inhibitor certainly improves clinical outcomes in this group of patients who are unfit for intensive chemotherapy. And I think what is going to be interesting to try to tease out from these data going forward is how they compare with patients who are also getting Venetoclax treatment now. I think probably the take-home message from the presentation this morning is that patients treated with the IDH inhibitor possibly have less toxicity than we possibly see with patients with Azacitidine and Venetoclax, although it's going to be a challenge for the international community designing clinical trials to test that going forward. I think the other very important data that was presented on AML treatment was of a retrospective collection of data from around big AML treating sites in the UK that looked at patients with relapsed or refractory AML that received combinations with Azacitidine or low-dose Cytarabine with Venetoclax, because I think this is something that's been accessed on a fairly piecemeal basis by different sites because of funding difficulties over the last 2 or 3 years. And I think it's taken a really big effort to pull all of these data together in a cohesive way. And we got some important updates on how potentially effective that can be as a salvage treatment strategy in AML that's relapsed or is refractory. And I think what's going to be important going forward is to try to come up with a unified national funding strategy to access of those treatments and potentially how we assess them prospectively in clinical trials going forward.